take great care of people, take science to discovery, and then train the next generation. And that's what we do at UF Health. And when you have such talented people in proximity, and when you access one of the greatest universities on the planet, you begin to stimulate ideas, you begin to have vision, and you can move forward and make progress.
When people feel like they've had extraordinary care here, that creates this sense of gratitude and a sense that they're doing amazing things at the University of Florida, and I want to help advance that.
We do really important things here, but we can't do it alone. We could not do what we do at the level we do without the resources, and to keep staying on the cutting edge, we really need support.
Philanthropic support is a major driver of being able to get things done. When I think about what's happened over the last several years, one that comes to mind is the Fixell family. And what starts off as a grandma and apple pie story of a son loving his father quickly evolved to a son realizing that his love for his father could change the face of how Parkinson's is taken care of everywhere.
When Lee looks at the University of Florida campus, he challenges us to go out and get the next generation researchers to build the best facility, to create the model, and to be the example that's going to push the field and try to move that needle. We're in this together to impact the world.
The research funding is just a means to an end, right? We've got to do really great things with the dollars that have been invested in our faculty to do research, and we have to have outcomes of those research that changes the health of individuals.
We are confident that if given tasks, we'll make progress. And it's our goal to align our capabilities with people's passions.
I know that Adam's dream would be that a cure would be discovered in the very lab that has his name.
Today, we have so many programs that are on this national scale. And when you begin to have programs that knock on the door of greatness, other people get interested. And so when the US News and World Report rankings came out and showed that in the state of Florida, that we're number one, it was this external validation. Nationally, we are amongst the best in the country, but it also reminds us that there's still more to do.
We've been on a great course, but we can go greater.
We want everybody to have hope. And hope doesn't come by some piece of equipment. It doesn't happen because we have some floor. Hope happens when families talk to doctors, nurses, scientists, technicians, and they realize we can give hope where hope doesn't exist. That's transformative.